So I'm here with Misty, also known as Chronically Anxious on TikTok. I've been in this place for decades, honestly, where I'm just like, what can we do about healthcare? What can we do about healthcare? Everybody wants to do something, but I know people care. And there's all these horror stories. When I saw your TikTok and you were just like, hey, I want to do something about this, help, help. I related because that's how I feel. And now that this Luigi thing happened, I thought, now we have some momentum.
That's exactly how I felt about that. I felt like the momentum was there and we really had to kind of
Yeah.
continue it and push it down the hill even more so we can continue.
Yeah. I would like it to continue in a nonviolent way, like
Amen.
because a lot of people think that somehow by picking up on the healthcare issues that we're somehow defending what happened. And in fact, it's the opposite. We're trying to make it so that this doesn't happen again.
Exactly. And I'll tell you that that was the first video I actually posted, was specifically saying I didn't like that violence had to happen in order for this conversation to really gain momentum. It shouldn't have taken this to like really start this conversation, but it's hard, right? Because the patients have one aspect, and as a provider, I'm a nurse practitioner, right? So it's even, I have a different perspective on how rough it is from our side, but I also see it from the patient side as well, because I have to work my ass off to get a prescription covered that's only $4 out of pocket, and they're paying how much for insurance? It's just wild.
So you're a nurse practitioner. Where are you from? Portland, is that right?
I am from Texas.
I don't know why I thought you were from Portland.
I did, and I
Okay.
actually lived there for a little while.
Okay. So
Yeah,
you're a nurse practitioner in
yeah,
Texas.
correct.
Okay. So you run into a lot of the ramifications of Dobbs and that sort of thing.
You mean the overturn of Roe v.
Yeah.
Wade? Yeah. So I haven't specifically come into any specific examples of me having to participate with difficult decisions like that. However, I had to have some really deep questions with management in regards to if I'm allowed to prescribe certain medications, such as Plan B, because those rules are really still not clear for us as well, especially from a primary care standpoint, which is what I do. People come to their primary care a lot for preventative treatment, which I would say Plan B is absolutely a preventative type treatment. So it's one of those things that we have to be really careful because it's not clear for us, just like it's really not clear for the patients. It's hard.
Yeah. And I also noticed you wore, because we're talking about t-shirts, you wear a Golden Girls t-shirt a lot. Are you a big Golden Girls fans?
I am. I
What is
am. Golden, I know, but I love this sweater I just got yesterday. Golden Girls is probably one of my favorite shows ever since I was a kid. It was on Hallmark when I was younger. And if I wanted to stay home from school or stay up really late, it would always be after Frasier.
Okay.
And I always felt like it was so ahead of its time, especially as a lesbian in this climate. And it felt like I was seeing something that I didn't see on TV shows from someone that was very in a loving place. It was very nice.
We watch it every day. I just watched an episode today, the one where Rose's boyfriend kisses Dorothy, because when
Uh-huh.
she was going to run away because she won a free honeymoon,
Oh yeah.
he kisses Dorothy, and then Sophia had a curse going on. I just love those shows. And there was a show me and my spouse went to a few years ago where it was like everything I ever wanted to learn about bioethics, I learned in the Golden Girls. It was a whole lecture about it.
It's interesting. I will tell you that this is a topic I actually talked about a lot because I realized that for some reason, some of my generation had never saw Golden Girls, and I felt like I had to educate them just a little bit on some Golden Girls history and lore. Just because genuinely, when you see it at first take, you got to go a little bit deeper and to realize,
Yeah.
dude, that actually is like a very deep show with the
It is.
stuff that they discuss and how serious they were able to really balance seriousness with comedy very, very well in that show, and hard topics like, that HIV episode that they did. That was one of the most I still think about that sometimes because it was so monumental for that time.
Yeah.
And the queer representation on it is also
Mhm.
it's probably definitely, I have to say, one of my favorite aspects of it because it felt like the first time I could be seen, really.
Yeah.
I love that show.
It aged really well, a lot better than like Sex and the City with all these cringe trans jokes.
Oh my gosh, it's
Horrible.
horrible. Like, you're right though, because it really did withstand the test of time. And that's really hard for almost any program to do. But it really, well, because it was ahead of its time, I guess. So it withstood its time because it was already kind of thinking in the future. Love that show.
They talked about issues. They talked about homelessness in a very good way. And
Great
well,
episode.
anyway, I'm glad to see that you're a fan.
Love.
I,
Fan.
there's so much to talk about, and I don't really structure things, so wherever this goes is fine. But I guess what I'm trying to figure out is why, how do we make something happen? I mean,
What's the
yeah,
answer? What can we do?
yeah, because I just feel like the immediate issue is that the people, everyone and the people don't really, when I have conversations with them about social media, I always get like, oh, Canada's worse. You're going to stand in line anyway. And it's like, and it's more expensive. Oh, do you want, and I have a hard time explaining, like, no, do the math because there's a huge chunk of money that's giving basically half of everything we spend on healthcare is going to billionaires to pay for yachts.
Yes.
I feel like the first thing we have to do is somehow convince the masses that this is something we need. And if the
Yeah.
masses want it, then we can get the politicians to want
I
it.
agree. And I think the misinformation is the hardest aspect of kind of circumventing all of these issues that everyone like brings up. Because I can tell you, I have many international friends and I've known a lot of people over the years internationally. And whether that be in Europe or Canada or whatever,
Yeah.
I've never heard one bad thing of the healthcare that they've had. Most of them say, why do people say this? That doesn't really, that's not my experience. And I'm the one living it. So it's like, those are the people we should be getting actual advice from if, Medicare for all type stuff is a good option, or like free healthcare in general, like what they have in Canada. But I feel like we're getting all this quadruple, third, fourth hand information that's accurate, maybe, but we don't know who it's from. And you just really you can't trust a lot of things that are on the internet. And that's what a lot of people do. And that's what's sad, because they see it and then they just run with it and believe it to be true.
I myself lived in the Netherlands for a while. I lived under their healthcare system, and it was very simple. You just have a card. They give you a card, and this was 30 years ago, so it's probably I know they've kind of slowly gotten more privatized because unfortunately they're taking some of our business practices, but they still have it. But like I used to have a card, you just give them the card, and that's it.
Yeah, and they don't ask for anything, nothing, no money. I remember I heard a story. One of my patients told me they went to Europe and had to there was some trip they were on, they had to get a surgery, or not a surgery, emergency room visit. It was something emergent that they had to do there. And they tried to pay and they were like, no, we don't do that. I don't know. It was kind of a wild story that they told me, and they were like, they wouldn't accept payment. And I was like, I can't imagine. You can't even get out of, I mean, there's no place in the world that would just give you something for free in the US, I feel like. You know what I mean? Like our country is so built on capitalism, we don't really know anything else.
Well, in my neighborhood, we have a gay men's health center, the Howard Brown, and they're very well funded, and anybody can go in there and they'll give you free PrEP or STD, whatever.
That's amazing.
But that's a very unusual thing.
And it's sad, right? Because like you just said, it's preventative. So like that's where I get to all this other stuff. We should be preventing illness, not treating it. It's one of those things that I'm really passionate about, especially in primary care, is that prevention should be the crux of all of medicine. Because if we can prevent the illness from happening in the first place, we wouldn't need to treat it, and we know how to do it, is the thing that's frustrating. Now, I read something, I can't remember if it was the Wall Street Journal, I don't remember, that said, I even posted a video on it. It said that curing is not good for business. Curing illness.
I saw that. I saw your post on it.
And I was like, this is the most transparent thing I've ever read. They're straightforward saying, I'd rather you be sick and dying and need us for that.
But I think we have to be clear, because you also pointed out that a lot of people blame doctors, and it's not doctors that are doing that. It's the other people in the organ, right? Like who is it? The insurance companies that have that mindset?
Yeah. So really what happens is based on, like I said, I'm a primary care nurse practitioner. Right. So based on my experience, what happens is so if a patient comes in, you have to bill. Have you ever heard of billing and coding? Like medical billing? Yeah. So medical billing and coding is literally all to make sure that the medical providers get paid what they're supposed to get paid. That's a whole section of practice that we have dedicated to that. Now, certain visits, whether you're going to, oh, my toe hurts, we have to code it as a certain thing. Based on that, that's what you get reimbursed. That is all dependent on what insurance you have. We don't set that. I don't care I couldn't care less what insurance anyone has. I just want to help them get better. It doesn't matter to me. It's something that we've dealt with for a long time, with how difficult it is to get just certain patients in because they can't afford the coverage. It's a lot.
I worked in healthcare in a past life. I've had a million different careers because I'm old and I have a short attention span. But in my career in IT and healthcare, I remember there was software that the coders use. Like, it's not just that you have to code it. There's basically an algorithm that you put in what's wrong with the patient, and then it gives you the codes you're supposed to use to maximize payment. And
Correct.
it's legal. And it's like, how is it? It's crazy.
Borderline. I know. There's sometimes where I'm like, it feels like I'm wringing a towel and trying to get every single drop of money out of these people. And it's like, that's not who I am as a human, because we didn't join medicine to squeeze money out of people. That's not what I wanted to help people. Right. And it's one of the most mentally and emotionally draining things, is having to basically give treatment that isn't as good because that's all that they can afford. So it's there's something demoralizing about that.
So what percentage of time do you spend doing stuff that's not medical?
Well, now it's better because I work for a place. It's different now. But like on average, let's say when I worked in a private practice, so if we work 40 hours a week, I would say it's closer to 60 hours. So I would say it would be an extra 15 to 20 additional hours a week. Yeah. Yeah. Just paperwork, and not even just paperwork, just like the bureaucratic BS in regards to having to check this box and this box to make sure they get their prescriptions they're supposed to get. But that's just one small example, because there's just so many issues.
So that's obviously something that would, when you talk about the money, it's not just the profits, it's also that inefficiency. And the doctors, at least from the videos I've watched, because there's a lot of doctors complaining about all the insurance denials, and so many of them have to spend time on the phone talking with their so-called equal, whatever they call it. The person
in denial. Yeah, and I'll tell you, I've been a part of those calls. So what you have to do is, if they deny because you put one wrong number, or you didn't put one thing in the chart, which they will, and they will send it right back to you, and then it goes through all this paperwork, but it's out of control.
So what was your immediate reaction to this Luigi shooting?
Yeah. Reaction was, oh, that's not unexpected. Yeah. I didn't feel like it was there's no part of me that wants anyone to get hurt in any sense of the word. And I said this in a video, that I really don't like that someone had to lose their life. They have a family, and then people argue, well, he's killed hundreds of people. And I get it. I get what they're coming from. It's just, I wasn't surprised by this, that like some people were. I think it's because of my unique experience, though, that I'm in medicine. So I've been seeing patients and providers alike getting more and more and more pissed, especially like with certain medications, like obesity medications, like Ozempic and different things. Companies were covering that for a while for people. And then they just all of a sudden stopped. Like, a lot of insurance has just dropped those medications, so people can't get them now. And I posted a video the other day about insulin. That's just another thing, is that people are like, I thought it was capped. They don't understand that insulin's only capped for the government insurance programs. It's not in general. Insurance isn't capped in general.
When you say capped, what exactly is it?
Capped, like the price. There's a ceiling. So like, I believe it's $35 with Medicare Part D plans, and that's the government subsidized insurance. But it's not. For people think that that's a blanket statement that all insulin is capped at $35. That's not the case at all.
So you're a type 1 diabetic. That means how much are you going to pay for that?
Oh, God only knows. If you don't have insurance, you're screwed.
Do people die because they can't get it?
People die because they can't afford insulin. Yeah. I know. I'm actually talking with a guy not too long ago who had a son. He calls himself the angry dad on TikTok, and his son passed away because he couldn't afford his asthma medication. So that's just one example, but type 1 diabetics absolutely can lose their life, and it's because insulin is so expensive.
And they do. And then you also mentioned I don't know what that medicine is called, for anaphylactic shock or whatever.
Epinephrine.
Epinephrine. So that, because you're making this argument, which I think is powerful, which, we have this system where, I would love to have Medicare for all, full coverage for everyone, but then there's this incrementalism that's going on. That's, we have Obamacare, which improved things, but maybe we should at least cover things that you need to live, right?
I think at the very least. You have these people that literally depend on insulin to survive because that's the way they were born.
Right.
They were born with, this is an autoimmune condition that you develop in life. You don't ask for it. You don't contacted or contracted. It's something that you're literally born with. And I don't think people should go into debt because of they're alive. You know what I mean? Just because I was born into this world with diabetes, I shouldn't now be in severe debt.
So I feel like that's a reasonable like legislative or approach to take, maybe. I don't know, just say like, can we at least make stuff so that, that people need to live,
At the very least. I mean, like we said, I mean, that's just one thing. Insulin to me is one of the first things that come to mind. Obviously, epinephrine is an easy also second one, just because that is an important thing. That's also very expensive if you don't have the right coverage, and you can and will die without it if you have a reaction. But those are the two biggies that I think about. And honestly, I didn't even think about EpiPens, which is epinephrine, until I posted the TikTok video about insulin, because people were like, hey, insulin or epinephrine pens, it's the same issue. It's X number of dollars for this. And then they said something else. They said they also expire in 1 year. So they can't keep them. And I don't have that problem. I don't know anyone that uses an EpiPen. I prescribe them a lot and I have to renew the prescriptions, but I don't think I ever really thought about it as an expiration. So it's an annual cost for them. I never really thought about it like that before, but it's expensive. So maybe, and you need at least 2 of them, I'd say. So $1,000 easy.
Oh my God. Oh my God.
It depends on insurance. I mean, there are some that will cover it, but it does depend on coverage.
It's so hard for me to deal with this issue because it's so insane. Like, how do we as a society allow such evil shit to happen?
That's right.
It's nuts. How do we have so little empathy? And are we just not getting the stories? And that's why I was trying to get these stories out there, healthcare horror stories. But I've honestly had very few people willing to share. And I understand a lot of people were like, oh no, I'm trying to get my claim approved. I'm afraid to go public.
Fair enough. Yeah.
Go on.
It's hard. It's hard. And I'll tell you, a lot of medical providers don't really want to speak on it. I feel like I'm just being honest.
I don't hear, but what you're saying is so obvious and so honest, but it's not something I ever hear, unless I dig into TikTok, really dig.
Fair enough. Fair enough. To be honest, there are some people who are like, you're like one of the only medical providers that's willing to speak about it. And blah, blah. I joined this profession because I truly wanted to make a difference in people's lives. I didn't join this profession to try and make a whole bunch of other people rich, because I see as many possible people as I possibly can in one day, and I don't even actually help them, because with insurance, you're basically forced to see as many people as possible, because the more people you see, the more payment you have. It's a horrible system that is bad for patients and for providers. That's why I try really hard to make sure that patients don't feel alienated. It would be easier for us if everyone had healthcare that was affordable, because we could actually help get our patients feeling better.
Yeah, and I also see like doctors, because of the profit motive, going into all sorts of wacky, like my friend goes to a doctor and it's like, it was like a normal doctor, and then he sold it to this other guy, and this guy's like pushing all this body resculpture. It's all cosmetic. He's turning it into a med spa because that's more profitable than just being a doctor. And it's just like, oh my God, you go in and they're like, they sell like harnesses and poppers and stuff. I mean, in a doctor's office, it's nuts.
No, it is nuts. It is nuts. Are they moving away from insurance at your practice? Are they still accepting it?
In my friend's practice?
At your friend's practice. Are they still?
They do.
They do. Yeah, they do have a new thing. It's called concierge medicine. Have you ever heard of it?
I have heard of it.
So it's a pretty unique thing. There's problems with that itself, because it's
you should explain it though, because I know, but that other people.
Fair enough. So concierge medicine or direct care medicine, you can call it either one. Basically, it's a subscription-based service for a medical provider that you have access to. If you subscribe to me as your medical provider, you'd have access to me basically anytime, business hours. You'd have a same-day appointment, always available. And it's for a specific fee each month. Your visits are covered, certain labs are covered, and they don't accept insurance. It's all cash pay. So you see them. Now prescriptions, obviously medications, you'd have to either use GoodRx or something like that, to where you would have your prescriptions be cheaper. So there's always that. But it's a good model and thought. But I think the problem is that, of course, you still have those emergencies that will pop up. My wife and I have oh shit insurance. That's what I call it, is oh shit. Like if something really bad happens, we're covered. But like, luckily, I know a lot of people that are able to help us out in regards to getting our prescriptions, and we see them and whatever. So we don't have to run off and pay a shit ton of money.
What is ocean insurance? It's a real insurance. Is that an
No,
insurance?
no, no. I call it ocean
No.
insurance. It's like it's insurance that we pay a decent amount for, but it's cheaper than other insurances. It's like if we get into an accident or something.
Just a high deductible?
Correct.
But it's full insurance, isn't it?
I call it ocean insurance because at least we have it.
Uh-huh.
Yeah, it's not the best. If we get into an accident, it's going to cover some things. It won't put us into debt, hopefully.
So, yeah. I mean, what do you think is the best like course of action? You said you're working with nonprofits, I think, but
Yeah, so I have a meeting with I'm trying to remember, I wrote it down, National Association for Patient Advocacy. I'm supposed to be meeting with them it was supposed to be this week. I haven't heard back from the date exactly yet, but that's my first meeting I have with them.
What do they do?
So they help with, in regards to help patients, how to navigate the insurance system and how to advocate for themselves to make sure they're actually getting the care they need and the insurance is paying what they should be.
Oh.
Yeah, it's a really good service. Even medical providers themselves don't necessarily understand how insurance works. It's intentionally confusing for all of us because they get more money if we don't use it. You know what I mean? And they try to avoid at all costs paying for the best medication because it's more expensive. So it's horrible.
I mean, like, what do you think happened with Obamacare? Just to tell you where I'm coming from, because I was uninsurable before Obamacare. I
Okay.
have cluster headaches, and so I couldn't get insurance. So I was paying like $650 a month because Illinois had like a sick bank. Like they put all the sick, uninsurable people together in a pool. And it was $650 a month, which probably would be pretty normal today. But it was pretty high back then, especially for my age. So I'm like, I try to explain, and plus the fact that if we didn't have that, that's because I was in Illinois, which is pretty progressive. But if I was in another state that didn't have that, maybe I wouldn't have been able to get insurance because, like back then, you had lifetime max, you had, so many pre-existing conditions that would just render you uninsurable. The kids were on their own. Obamacare does a lot, but it also leaves a lot to be desired. What do you think about that?
So it's hard. When Obamacare, I was still in nursing school when Obamacare came out, so I didn't really work as a nurse practitioner in the field for that. I do know that there were a lot of people that were denied coverage due to pre-existing conditions, and it was very difficult. You didn't ask to get cluster headaches. You didn't contract cluster headaches. I don't think that because people have depression or anxiety, that shouldn't cause issues. Or for the love of God, if someone has cancer or COPD, that shouldn't inhibit them from getting seen in the best care possible. But I honestly don't know a lot about the Obamacare stuff just because I didn't really have a lot of exposure to it. But I guess I can give this perspective. I can't imagine if Obamacare was removed, which I know that's being talked about. I can't imagine how many people are going to be in real deep shit because it's going to be ugly and it's going to be bad because most people have a pre-existing condition, not some, most.
Yeah.
So it's like, am I going to be uninsurable? Is my wife going to be like, she has thyroid condition? Is she going to be like, I mean, I have anxiety. Am I going to, it's like, what is a pre-existing condition that makes you uncoverable?
I have more anxiety.
Yeah, exactly. Medical anxiety, insurance induced. It's ridiculous. And I can give the perspective that it's really wild for me to even think about that people can't get medical coverage. Like, to me, that mindset, I can't even think. That seems unreal. It seems unrealistic to me, but I know it is because it's happened. But I didn't live through that.
That's good. Did you hear about how there's a Texas case that's going to the Supreme Court? It came out in last June, but they just said Friday it's going to go to SCOTUS. They're basically trying to make PrEP not covered by Affordable Care Act, which would also make a whole lot of other preventative medications not covered, which is insane. Can you imagine, like, what are you trying to say? You'd rather have people have HIV and need medication for life?
And it circled back to what we said earlier, right? Is their goal. They don't want to prevent illness. They don't want to. They want to make people have to use $1 million prescriptions to treat HIV instead of preventing it from happening altogether. And to me, that's where people say that Brian Thomas is a killer himself. And it's like, I'm not going to get into that argument. I hear where they're coming from. But the point is that I get it in the sense that if they aren't available to treatment and they die, I see where they're coming from. But I don't know.
I think part of it is Christian right and hating gay people. I really do, because why would they go after that one thing?
Well, we could start with hating women too. I mean, they went out after Roe versus Wade, and then queer people are next. I mean, that doesn't really surprise me. It seems like we're repeating history more than anything, which is so depressing. It's so sad and so depressing, but I wouldn't be surprised. You said is it from a Christian organization that's like funding this?
No, it was some, I don't know. I don't remember.
Because I didn't hear about
It
this.
wasn't. It was some small company or group of, it was like a small business. And they're like, well, we don't want to cover that in our small. It was kind of like the thing that they had with a while back with the Hobby Lobby, where they're like, we don't want to cover abortion, because we have moral objections to it.
Sure.
And then somehow, I don't understand the legal stuff, but somehow they said, the lawyers or whatever, the judge, I'm explaining this horribly because I don't get it. They said basically like, we want this to apply to the whole country. And so the SCOTUS is going to decide that. And
if that happens, I will just lose it. I will lose my mind.
It's going to go to SCOTUS, and the thing I hate, to me, it's like terrorism, because then we're going to sit there. We're going to have to wait 6 months for the stupid decision. Everybody's going to wait in June, just like they do with jobs, just like they do with everything. They have to wait for the Supreme Court to come down with their decision to see whether or not we get to live or not. I mean, it's ridiculous.
It is ridiculous. And it's wild because all these people, and I don't wish ill on anyone, it's different when you've lived the problem. It's different when you have a loved one that's lived the problem. It's different if you've seen people live the problem. And if these people haven't been exposed to that, it's hard for them to really understand. And I can get that if they don't have the perspective of seeing the problem, but it's impossible to not see it now. You can't, we have social media, we have all this stuff. You can't say, I didn't know this was happening. I'm so shocked by all of these people's outrage. No, you're not. You see it. We're here. And you know that this has been happening.
I just don't understand why there's so much hate in people's hearts. But at the same time, like, look at what did give me hope to see the people, because you had mentioned too that it is both, it's left and right. The reaction to the Luigi and the murder of Brian Thompson, the reaction in just being defiant against these insurance companies and exposing them and being just so angry. That was from the left and the right, I think.
Absolutely. Absolutely. Like you said, I said that in the video too. This isn't a left versus right thing. I've never felt more bipartisan support on one issue, like in the general community.
Yeah. And it's tricky because I feel like we have to do this in such a way that doesn't just say, oh, this is all because of Trump. It's like, it's not, because really there's so much that both parties could have done. Both, it was, Obamacare was great. It was huge, but it also was a huge, it was a gift to the insurance companies. They're so rich because of it.
Yes.
They get so much money, and so much of that money is our taxpayer dollars that they just give to them for the privilege of turning down claims.
Yeah. I mean, let me tell you something that will blow your mind. So there is something, have you ever heard of Pharmacy Benefits Manager?
Yeah.
So United Healthcare owns Optum Rx.
Yeah.
And most other insurance companies have a pharmacy that they work through, and they have to negotiate the payments of the prescription medications to the insurance company, but they take all the profit and then they even sell at higher cost. So basically, the insurance company is making even more money off of their pharmacy and the prescription they're selling you at a higher cost than what they bought it for.
Yeah, and they own the whole system. It's like, or CVS owns Aetna, or Aetna owns CVS, and then they have a pharmacy benefit manager too, and it's all the same. What about antitrust? I mean, it's nice that the government's going after Google for their stupid web browser. That's lovely. But how about breaking up the real antitrust, which is
I mean, TikTok came in and came out. It's about to come out real quick. They're real quick to remove that when they think there's a problem. But when we have people dying by the thousands because they can't access healthcare, that's not an emergency. But we have one person die in New York. That's terrorism. That won't make sense to me. They can't. When they said they were going to charge with terrorism, that won't make sense to me. I understand that incitement of terror is what terrorism is, but then you could basically say every crime is terroristic in nature because you're going to be terrorized in some way.
Well, I think when somebody has cancer and they're dying and they have to beg to get their claims approved, and even if they do get them approved, and they might turn them down after they pay it out. And then you go into bankruptcy.
I agree. I believe it's theft. I believe it's fraudulent. I think that if medical providers have to say an oath to do no harm, insurance, I don't think it's out of the possibilities that they should make insurance companies do that too. Because if I didn't prescribe an EpiPen to someone I knew that had allergies that could kill them, I would be held liable. So why are they not?
One of the doctors on TikTok showed a printout of a United Healthcare contract, and they're not all the same. And the UHC contract said, you, the doctor, have to provide care regardless of whether or not we approve payment. So they're just saying, oh, we may not pay it, but it's your fault, doctor.
Correct.
You're the ones that have to, because you don't have a multi-zillion-dollar lobbyist behind you like we do. And it's evil. God.
It's evil. Yeah. And like you've said, you can get initially approved and then they get something else. And then they're like, oh, never mind, we'll take it back. Or if there's one, I can't even tell you if there's someone's name is wrong on a chart, which isn't the patient's fault, but if there's an issue with a name or if someone had a name change, that is a nightmare with insurance, because if you see someone with the wrong card or the name is incorrect, it will just go from one thing to the other and you will not be able to get the money refunded. You just won't.
It's cause a problem with the transgender people.
Yes. I can't even imagine what that process looks like. I don't know in regards to like after they get their gender affirming surgery, or if it would be as long as they can legally change the sex on their license. I think it would be easier. Unique situation though. I haven't run into a problem with it. I have a few transgender patients, but I haven't had a problem with that yet.
So what do you think we can do? I mean, I don't know. I'm so frustrated because now they're going to take TikTok away, right? So I don't even know what I'm supposed to, how can I even get the word out aside from my podcast, which, is fine. But with social media, you kind of have to have one of these major outlets. And the reason I like TikTok is because, I get de-amplified on all the other ones. I put the same video that could get 100,000 views on TikTok. It'll get like maybe 500 at the most on Instagram because they just don't want to see that shit.
Yes.
That's a coincidence.
No,
right?
I don't think so either. I think they want to keep, first of all, they don't want to piss off the people that are paying their bills too. They don't want to get removed like TikTok's getting removed. And they say it's because it's Chinese, but I have a hard time believing that they can't sell me on that one.
No.
I just don't think they like that we're able to get information to one another in a very rapid way.
Yeah. And they don't like that they can't get that data mining that they can get from Facebook and all they have to do if the government wants information on you is subpoena and say, give me everything that this person does on Twitter or, Facebook or Instagram, and they can do it. But I don't think they can do that on TikTok.
And that's amazing if they can't, because I would love that. But that's exactly why you said they don't want us to have that freedom.
No.
It's wild.
Bothers me most about that. It's not even the lawyers and the whatever you call it, the congressmen and all that who signed the law. It's the people who defend it they're just normal people, and they all just, parrot the talking points of the government lawyers, which are basically like, oh, well, the Chinese government doesn't have any rights. We're just telling them they have to sell. We're not affecting people's free speech rights. I'm like, dumbass, no. People have created content. They have a body of trillions of videos out there, and they're all going to disappear. That's freedom. All that freedom, all that free speech is going to be gone. And you can put whatever legal maneuvering you want to, but you're taking away people's free speech, and that's unconstitutional.
Yes, I agree completely. And they can.
Everybody's playing these mental games to get around it because they're just buying into the propaganda. China bad, China bad. Well, I don't like China either, but I also believe in free speech. So,
amen. Amen. And like I said, they can, and that's where it gets hard because you have to know I have some people that I know that it's not worth talking to about certain issues because it's like, they believe what they want. And I have nothing but respect for those people that have their beliefs, that's fine with me as long as you don't want to hurt anyone or, you want to make sure everything's good. I don't care what you believe in.
Right.
It's hard.
I just don't know what to do.
Yeah, I know. And I think I've been kind of seeing what I can do, especially from the side of what I'm on. And I'm actually going to go to Austin, Texas, the legislative meeting in March with one of my friends who's become a nurse practitioner, legislative associate type thing. And we're going to talk to the state of Texas to see if we can try and get nurse practitioners more rights in the state. It's just one step to try and get even more access to more people for healthcare. Oh, in Texas, nurse practitioners have to practice under a physician. In other states such as Washington, Oregon, those are two, for example, you don't have to have a doctor oversight. So you can see someone without that. So that's what we're trying to do in Texas too. That's just the goal for now, but it will help people get more access to care because it'll allow more people to work.
Probably cheaper.
Oh, definitely. With the direction we're moving, who knows? It seems like everything's just getting more and more expensive.
Do you have a sense of how we could like make universal health care happen or Medicare for all happen? Or
So I was actually I was on the phone with the Florida representatives of a bunch of different congressmen and different things. I know it sounds like BS because that's how I feel. It's like, write your congressman, talk to your congressman. I can tell you the biggest and most important thing is to keep this conversation going. Because like you said, that's the Brian Thompson, Luigi thing. It really started it, but now it's kind of continuing and continuing. And I don't want it to lose that momentum. So, and nobody does. And I think if the conversation continues to happen and we continue to speak about it like we are and make sure it stays in the news, that it will help.
I think you're right. I think that makes sense. Like I'm a big fan of these personal anecdotes. Like I'm a huge fan of Studs Terkel. He used to tell stories of everyday people. That's why I really want to just have people on sharing their situations. So that's what I would like to see happen. But I really need people like you to come on and do it.
I know what you mean. It's hard because, first of all, people are shy about their medical information, which I get. That's their private stuff. But in regards to people in my line of work, they're nervous too because they don't want to speak out too much. But I'm not saying anything that other people aren't saying. You know what I mean? I'm just saying it for more people to hear it. So to me, it's a hard thing, especially if you're not comfortable with talking to people about something so personal. It's hard.
But even keeping the conversation going like this is better than not.
Absolutely.
Yeah, I get so frustrated because you know what? It's just cheaper. It's cheaper. It's better. It's more humane. Why would we not have this when, like you said, every other developed country and some underdeveloped countries have this? Well, do we have ourselves? I mean, it's not.
It's going to do this. It's going to do that. How does every other country make it work? Are we not smart enough to figure it out? Because then we have more problems to worry about.
It seems to me there's a lot of propaganda, and the remedy to that is media literacy and education. We don't have much of media literacy.
I would say that there is a large gap in healthcare literacy and literacy in general. So it's hard, and any state will have it. We struggle, the school system is a whole other subject when you're trying to get kids to read and stuff. It's hard. My wife used to be a teacher. God bless her, and God bless all the teachers. Good Lord. That's a job I could never do.
What does she do now?
She works for adult education.
Oh, so
she's an adult educator. Yeah, so she's still in education, but she wanted to move out of the public school system. So when she did, I'll tell you, literacy in general is hard, but healthcare literacy is basically negligible. In this country, if people can't if the average person can't read above maybe a 6th to 9th grade level, how do we expect people to understand these explanations from these government sources that are explaining these detailed things? When I went to change my voter registration from one county to another, they literally made that the most difficult thing I possibly could have ever done. The verbiage that they used. I'm a native English speaker. I have a master's degree, so I should be able to understand decently high level wording. And I was looking and I asked my wife, I said, I don't even know what this means. Like they're intentionally making it hard for people of high education to understand it. So when I was thinking, I was like, what if people can't understand this? Like I barely can understand this. This doesn't seem right. It's intentionally difficult. So, and that's just with voting. That's a whole other conversation. But with medicine, it's even harder because, we take a class called medical terminology in school. It's because medical terminology is basically a new language. Because it's a whole other subset of words and you have to relearn everything. So if people already can't read well, they can't understand. I mean, medicine is already put at a level so high and doctors make everything so almost intentionally confusing. It's so hard for the patients to really do their best when they can't really understand what they're supposed to do in the first place.
Yeah, and plus it doesn't help that the president has this 6th grade reading level.
That's a whole other thing. It's a sad situation. I'll tell you, it's the most sad thing. I say being a woman in the United States, but being in the United States, period, right now, it does feel really depressing. And it feels like other countries are kind of just pointing and laughing at us. Not literally.
Some of them are doing the same thing.
That's
Turning
true.
right, hard right, a lot of
Yeah.
countries.
I don't understand. And like you said, I wish I could sit down, and I'm not someone who argues. I'm really someone who listens to other people's perspectives, and I want to learn. And if I can gain knowledge from your experience and your perception, I will. But the conversation just has to continue. And it's really hard. If it dies down, it's going to be really hard to pick it back up again.
It already is dying down.
It is.
Seems like it.
It is. And that's why well, first of all, I was off TikTok for a couple weeks because of family vacation. But I did notice when I got back, it seemed a little bit less active about the topic, and that made me sad. But as long as you kind of keep the momentum forward, which is what I'm going to do and what I'll continue to do, it doesn't mean it's dead.
Well, thank God the guy's a sex symbol.
It doesn't hurt. I'll tell you. He is quite the looker.
You need to turn him into like a Che Guevara, make T-shirts. I think that's already happening. But that's, people interpret that the wrong way. Of course, idolizing him is just a way to get the conversation. And I'm conflicted because part of me says, yeah, I want to appeal to the left and the right. But the other part is I see this as a failure of the progressive movement because, like, it seems like Democrats are abandoning the far left part of the progressive branch. And they're a bit saying, oh, no, we need to move more to the center. And then Trump is being very clever, and he's grabbing the center in a disingenuous way, saying like, "Oh, I'm here for you. I'm the worker." So he's getting them. He's like playing he's tricking them, right? Mm-hmm. He's tricking them to vote for him because the Democrats are ignoring them. What the Democrats should just be. I had this conversation with John Edwards, who ran for vice president a long time ago, and then he had a sex scandal. But I told him, he's like, "What do you think?" Because when podcasters were new, and they cared what we thought before they turned into broke. Never mind. It's a long story, but now it's all bros and I'm just thrown to the wayside. But I said, well, Democrats just need to be Democrats. Be proud of being progressive. Be proud of your values and say, look, we're going to believe everybody should have an education. Everybody should have health care and education, health care, whatever else I'm forgetting. And we should be proud of it. And if you want to call us socialists, that's fine. Call us whatever you want to. I don't give a shit.
That's how I feel.
Oh, no, we're not socialists. Well, then you're disenfranchising a humongous percentage of people, and they're going to go vote for Trump because you're an idiot.
Yeah, and I will tell you that
whole TikTok doesn't help. I'm sorry.
No, you're absolutely right. It is because that's where people that agree with the left side more get some of their stuff because you feel kind of alienated otherwise because it's mostly right. And like I said, right and left, it doesn't matter. The point, it's central, it's bipartisan in regards to the healthcare support.
Yeah.
I was going to say voting and making sure that who you vote for align with what you believe in regards to healthcare reform as well. Now, I know it's hard because there are other things that you might not agree with and certain things. There's never going to be a perfect politician, right? I tell people all the time, there's no perfect answer, but there has to be a better solution than what we're doing now. It exists. We know it exists. It already does. How come we can't do it?
Yeah.
It's something that if other countries can do it, why can't we just go over to Europe and say, hey, what do you do? I like it. It works well. Let's do that. We're supposed to have a good relationship with all these countries, and we're supposed to have the smartest people ever here. It doesn't seem like it. If we're so smart, why can't we figure it out?
I don't know.
I will tell you, man, it is so hard. Like when you work with patients that are even below poverty line, or even if they're close to it, like they have to choose like food or medicine, or shelter or medicine, or gas or medicine, or food or my kid's medicine, or my kid's medicine or mine. It's like, and that to me is like a whole, it's really, really, really sad when you feel like there's nothing you can do.
Those people need to at least have insurance that has no deductible. Why is that not happening? Why don't they have that?
That to me is crazy too. And then they have the co-pays, and then they have co-insurance. And I don't even know what that is. I don't even know what co-insurance is.
It's so complicated. I don't understand.
Intentionally so. And people do think that medical providers know all the ins and outs. That is by far from the truth. We do our best through our department, that is the billing and coding department, to make sure all of that gets done and the patient gets exactly what they're supposed to get and not charged anymore. Now, I know some places don't do that, but I know that that's the way it should be done. I agree. Like, I don't understand how there's not a zero copay. You already pay so much money per month. Where is that money going? What are we doing with the money that we pay our premium every month?
Yeah, they're like, okay, we're in a system that sucks. If you're like making a good income and you can afford a copay, okay, I guess have a copay. For those people you're describing that are choosing between food and medical, they should have a completely subsidized plan with zero copay,
Yes.
zero deductible, zero everything. Why can't we at least add that to Obamacare? Well, it's going to be hard to do that when we have people that want to tear it down completely.
Yeah, they won't add to it. They'll remove it first. I know. That's the face I made when I saw it.
Replace it with Amazon.
Don't start. Like, I saw Amazon's doing all those virtual things now in the pharmacy. And I told my dad years ago, I was like, as soon as Amazon gets a pharmacy, game over.
Yeah, they're advertising on TV now.
Huh?
Well, they're advertising on TV now for the pharmacy.
Mm-hmm.
I saw an advertisement this morning, and it's like, "Oh, your mother wants you to go to the pharmacy, but you told her to get Amazon, and she didn't." And they show him waiting in line and having to stand behind someone to buy chips. And I'm thinking, do you really want to have to argue with a robot about why you're not getting your life-saving medication? It's crazy.
Yeah, because you're going to have the same problems virtually on Amazon as you would in the office. And it's going to go back to what's called prior authorizations.
Yeah.
And that basically means that you have to convince the insurance company that the patient needs the medicine you're trying to prescribe. So then people will argue. So that's basically the insurance company practicing medicine. Yes, it is. And I have to take a test for that. I have to go.
Why is that legal?
Exactly. That's what I will tell you that I didn't realize how bad all of this was until I graduated out of school and really started. And I was like, because they kind of sugarcoat things when you're in school. But I was like, oh my God, this is so much worse than I ever realized. So much worse. And it's now like in the forefront and more people are talking about it, and I'm thankful. I just wish it didn't have to go the way down the way it did, but I am thankful the conversation's here.
Yeah. Well, I will pick that up and say, your initial TikTok that got me interested. I'll talk to anybody, just, I want to talk about this. I'll talk to anybody. Just let's do it. And I'm saying the same thing on this show. If anybody wants to talk about it, I'm here. Let's talk about it. And I just want to, like you, continue the conversation.
Yeah.
I don't know what to do. I don't have a plan. I like what you're doing, contacting congressmen. I think that's great. Anybody that can do any direct action is fantastic. I mean, healthy, legal direct action. And I don't believe anybody should break the law at all for this.
Yeah, because then you'll just end up worse.
No,
it's not going to help you, and nobody needs to do anything wild.
Yeah. So thank you so much for this. And anytime you want to come back, let me know. I don't know. This show used to be just talking shit all the time, but I'm not in the mood for that anymore. I'm too old for that shit.
I like talking shit too, though. So if you feel like reminiscent about old times, I can do that also.
Okay.
Especially the Golden Girls.
Oh, yeah. We'll have to do a show about that.
Yes.
I don't know how many times I've seen them. It's ridiculous.
Oh, I've at least seen it 3.5 times through, at least. I did want to say, so I'm actually trying to get some more. I want to try and get on a couple more podcasts or anything with people. So I don't know if you know anyone that you could reach out to that would be interested in doing a conversation like this in regards to healthcare.
Not off the top of my head, but I'll certainly keep it in mind. I used to have a whole network of podcasters, but everything it all got taken over by the bros and all this
Don't start with me about the bros.
Shit. Yeah. But there's sometimes I do get a lot of emails. There's PR agencies. I know it's probably not what you're thinking of, but there's a lot of PR agencies that deal with podcasts, and they'll say, I have so and so, and they want to talk about this issue and this issue and this.
Oh, okay.
So I don't know how you would get in touch with one of those. I think that would be good, because what they do is these agencies, they mail stuff out. Basically, it's like having representation.
Okay.
Then they will email all the podcasters. They have these big mailing lists of podcasters and say, do you want to talk with this person about this? Unfortunately, usually the people they want you to talk to is like, so-and-so is 10 million likes for, showing her booty, while she's, dumb shit. But they have people. There's a lot of LGBT stuff too. They're yeah.
I was excited because when I looked up Madge Weinstein, and I was like, oh my gosh, this is so cool. That's so you interviewed Lady Bunny, right?
Oh yeah.
Oh my God, I saw that, and I called everyone that I knew and told them guys, I'm going to talk to someone who interviewed Lady Bunny. And my wife was super pumped about that. She goes, that is so cool. And I said, I know. I could not believe it. I was like, oh my gosh, Lady Bunny. I love RuPaul.
I know Lady Bunny quite well. We used to talk all the time, but we've had certain falling out lately.
Uh-oh.
Yeah. But yeah, I know her.
Yeah, she's, I like watching her shows are good.
She's funny.
She's hilarious. My God.
Have you ever seen her in person?
No, no. But that's definitely on the list. My wife and I really want to. But I saw that and I was like, no way. And then my wife and I were super pumped. So it was exciting.
Oh, yeah. Yeah, if you go back, there's quite a few talks I had with her on the show.
I saw that. That's very cool. Very cool.
Yeah.
Love her.
Good.
Yeah.
All right. Well, it was really great meeting you, great talking, and stay in touch.
Absolutely. I definitely will. Very nice to meet you. I hope you have a good rest of your night.
You too. Thanks.
Bye.
Bye.
Thanks.